episode number 1 of the Star Wars School of Dentistry podcast. I am your host, Ryder Waldron. I am a private practice general dentist and a huge Star Wars fan, and on this podcast, I will try to merge my career with my passion. Now, when I've told people that I'm going to start a podcast about Star Wars and dentistry, most people ask why I'm doing it and how I'm going to pull it off. One of the reasons I wanted to do this is because I know about two things, Star Wars and dentistry, and probably in that order. But the main reason I'm doing it is because a friend of mine from the Star Wars community, Jeff McGee of Marvin Dog Media, suggested it to me years ago, and I didn't think anybody would listen to that, so I put it off, but it stuck in my mind. And then I saw Jeff at Star Wars Celebration a few weeks ago in Anaheim, and he brought it up again and said it would be an interesting topic. So we discussed it for a few minutes, and then we discussed it for a few more minutes after that with Dan Zer of Coffee with Kenobi. And then that night I started brainstorming some ideas. So here we are. So I really want to thank Jeff and Dan and everyone who has supported me in doing this. And I really want to thank you for listening also. So what will I be talking about on the Star Wars School of Dentistry podcast? On each episode, I'm going to take one character or a group of characters if they're the same species from the Star Wars galaxy and try to diagnose them, recommend treatment, discuss concerns and possible complications I'd anticipate, and discuss generally what these treatments entail. I'll also use some of their quotes from movies or other media to help determine what kind of a dental patient they may be. And at the end of each episode, I will say if I would like to treat these patients in my practice and why or why not. And obviously I can't examine or x-ray or talk to any of these characters, so I'm going to make some assumptions based on my experience. I'm going to use pictures and video of the characters, and I'll be posting some of these pictures on Twitter and Instagram, so you can look at them if you'd like to. The show's Twitter account is @StarWarsDentist, and on Instagram it is @StarWarsSchoolOfDentistry. So you can go check out those pictures right now if you'd like and kind of follow along. Also, I'll take suggestions on characters for future episodes, and you can email those to starwarsschoolofdentistry@gmail.com, or you can send those on Twitter also. And I've got several characters and topics I'd like to cover on this podcast, and maybe you'll have some great ideas too, so send them to me, and I'd like to take a look at them. If you're a dental professional, I'm hoping this will be fun to help diagnose some fictional characters. If you're a Star Wars fan, I hope it'll be fun to get a different perspective on the galaxy far, far away. And if you're a dental professional who is a Star Wars fan like me, then you're just the ultimate nerd. So we'll hopefully have some fun doing this. So let's welcome our first patient at the Star Wars School of Dentistry. Our first patient at the Star Wars School of Dentistry is Emperor Palpatine. In my opinion, the most evil and manipulative person in the Star Wars galaxy, but he is such a great character. I love him in everything I see him in. He was a senator on Naboo, or from Naboo. He manipulated his way to Supreme Chancellor and then started a war that led to him anointing himself Emperor. And he also has some of the worst dentition, the worst smile that we've seen in Star Wars. So I will be focusing on his time from when he became Emperor, not necessarily his time as senator or chancellor right now. We'll probably get to that later on in the podcast in some future episodes. I've posted the pictures, like I said. I'll post pictures on Twitter and Instagram. The pictures I'm going to be using are from Return of the Jedi and Revenge of the Sith, so you can check those out. So let's take a look at Emperor Palpatine and see what we can diagnose on him.
So be it, Jedi.
So what really jumps out at first with this comment is his arrogant and condescending tone, and oftentimes patients are defensive in the dental chair due to fear or previous bad experiences. So right now I'm going to give the Emperor the benefit of the doubt, and I'm really going to try hard to gain his trust. What I first noticed with Emperor Palpatine's teeth is that they are discolored, have heavy plaque and tartar buildup, and several broken anterior teeth. And if we look at him from Return of the Jedi, we notice a lot of spacing between the teeth also. So prior to any treatment, I like to discuss the patient's goals for their teeth and smile. Do they want a perfect smile? Do they just want functional teeth? Do they want to be out of pain? Do they even want to keep their teeth? Some people don't. This will help me determine the best course of treatment for each patient. After that, I like to discuss how they got in this condition in the first place. Did they go through a traumatic situation in life? Are there overall health issues or medications that may be contributing? Did they fall into bad oral care habits that can be corrected? The answer is most likely yes to all these questions with the Emperor. But getting to know the patient and knowing their goals will allow me to better treat and serve them.
Did you ever hear the tragedy of Darth Plagueis the Wise?
Sometimes, as a dentist, you're a sounding board or an outlet, especially for older patients who may be stuck at home a lot. They have no one to talk to. So I listen to their stories. I like to show them that I care about them on a personal level rather than just them being another patient in my office. Helps me to connect better with the patients and to gain their trust. But the main reason they're in my office is for dental treatment. There is most likely some periodontal disease in Emperor Palpatine's mouth, but I'm going to save that discussion for some future patients where I think it'll work better. What I really want to focus on with the Emperor is his smile. So when we look at Palpatine's teeth, we see several broken and possibly decayed anterior teeth. The smile is discolored. In Return of the Jedi, we can see more spacing between the front teeth, most likely due to some periodontal disease and the teeth shifting. In most surveys, people will say that when meeting someone for the first time, they list smile as either the first or second feature they notice. So a smile is important for people. Emperor Palpatine's face is on the HoloNet fairly often, so he may want to improve that smile. He's the face of an empire, and assuming the bone and gums around the teeth are sound, then we can begin treatment. So the first question I usually get with these types of cases are, can I just whiten my teeth or can I put veneers in my teeth? Not usually in these situations because the teeth are so broken down and there's probably decay and maybe some other issues. So we need to get a sound foundation first. So we need to remove any decay or fractured areas on those teeth first, and then we can restore them with fillings or crowns, veneers, and then we'll talk about some other options also. Conservative treatment would include placing some tooth-colored fillings in the broken teeth after removing any decay. So this would mean we remove any cavities in the teeth, we bond in some tooth-colored filling material, and then shape and polish it as best we can to look like natural teeth. That'll make the teeth fairly functional and look better, but the strength of the teeth would still be pretty questionable, and the aesthetics would not be ideal. Not a great smile in that situation. A better and longer lasting option would be full coverage all porcelain crowns. So these would be able to close those gaps we talked about between the teeth. They will improve his smile and the color of his teeth. He can pretty much choose whatever color he wants his teeth to be. And with the improvements in porcelain, they would definitely strengthen his teeth. And at the first appointment, I would remove about 2 millimeters of tooth structure from all surfaces of the teeth I'm placing the crowns on. Then I get an impression or a digital scan of those teeth and send that to a dental lab to make the crowns. Those will be ready in about 2 weeks. So in the meantime, temporary crowns are placed to protect the teeth. And then 2 weeks later, Emperor Palpatine would come back. I'd remove the temporary crowns and cement the permanent crowns on. If the bone loss is too severe or the teeth are just simply not restorable, then it's time to discuss removing all the teeth and make a full denture or place some implants and attach some sort of a prosthetic to those implants. Implants can be placed that will, hold in a full denture or another type of prosthetic. Implants are another treatment that I'm going to discuss more in depth on a future episode. But understanding what the patient's goals are helps me help them decide on their treatment. I give them all the information and then we discuss things and decide what's going to be best for them.
Wipe them out. All of them.
And that's why it's important to listen to your patients. Find out what their goals are and leave the final decision up to them. I give them their options, but legally they have to make the decision about the treatment. And my main goal is to make my patient happy, in this case, Emperor Palpatine, and give him the best possible treatment outcome. So if he chooses to have all of his teeth removed, I want to work towards that for him. One last thing I would recommend for Emperor Palpatine is to wear a night guard while he sleeps. A night guard is an acrylic appliance that protects teeth from grinding, which can occur when a patient is overly stressed. Now we know he has the stress of oppressing an entire galaxy. He's working with underlings who are sometimes incompetent at best, and he's standing up to a rebellion, and it looks like he may grind his teeth, which can result in more broken teeth. He's also prone to fits of rage, which cause a lot of stress on the teeth and the TMJ, the temporomandibular joint. So no one wants to go through dental treatment only to have it break down due to something that is preventable. So a night guard is a great preventative measure. As a dentist, it would be nice if I could just restore the teeth and mouth. Unfortunately, there's a patient attached to the teeth and the mouth, so just because the teeth and mouth are fixable doesn't necessarily mean it will happen. I need the patient to be compliant and cooperative with post-operative care. So a dentist must take into account everything about the patient: attitude, motivation, home care, overall health. I take into account also what the possible risks and complications and concerns may be based on getting to know the patient. And after fixing the teeth, I can give recommendations on how to maintain their oral health going forward.
Your feeble skills are no match for the power of the dark side.
While that may be true, I do have enough experience over 19 years of practice to know that proper home care is of the utmost importance to maintaining a healthy mouth, and I still have to give the patient my best recommendation, even if they think they know better than me. So, lack of proper oral hygiene at home is most important in maintaining good oral health. Brushing 3 times a day and flossing at least once would be best for Emperor Palpatine. He clearly hasn't been doing that, looking at some of the plaque and tartar buildup in some of his pictures. Most likely as a senator and then as chancellor, he was keeping up on these good habits, but when he had a fledgling empire to lead, his time was spent in other areas. Another recommendation is keeping up on his regular dental checkups. With someone like him who travels around the galaxy, logistics is the main roadblock. How do you see a dentist when you're on the road regularly? I have a lot of patients that travel for business, and this is a pretty common problem. So with Emperor Palpatine, that responsibility may fall to one of his assistants. Massa Amida may need to schedule it for him, or instead of having creepy old advisors wandering around in his throne room on the Death Star, he has a creepy dentist wandering around to remind him to brush and floss daily and to keep his regular checkups. It's not a bad idea. I tell my patients that I don't care what reminds them to keep these healthy habits, just find ways to remind themselves, especially flossing. I tell them to do it while watching the HoloNet news each day, or right before bed, or after dinner each night. Just find a way to remember to do it. Another concern with Emperor Palpatine is his age. We don't like to admit our mortality, and this may not be quite as much of a concern for the Emperor now that we know the events of the rise of Skywalker.
I have died before.
Yeah, that may be true, but it's still a conversation that needs to be had. Teeth tend to break down as we age. Years of use and possibly neglect can contribute to that. Dry mouth due to some medications is a huge concern and allows bacteria to run rampant in mouths. So with Emperor Palpatine, extra fluoride and staying hydrated will be very important. One final concern with Emperor Palpatine is Force lightning. He's been shot with Force lightning by himself, actually, at least 3 times that we know of. In Revenge of the Sith, in Return of the Jedi, and again in The Rise of Skywalker. I'm not familiar with any studies that have looked at the effects of lightning on teeth because that's not usually the main concern. The main concern when being hit with lightning is, are you alive? But I can't believe it would be good for any part of your body, and especially the nerves and the teeth. So I would advise him when using Force lightning to do his best to not let it get directed back at himself. He seems to have a problem with that. Just like I recommend athletes wear a mouth guard when playing contact sports. So anything you can do to protect your teeth from more trauma will help you keep your teeth longer and keep you out of the dental chair, which is everyone's goal. Now, would I want Emperor Palpatine as a patient in my practice? Absolutely not. He's impossible to please, so no matter how well treatment went, he may still not be happy. Some dentists may see that as a challenge, but I don't like challenges that may result in my death, and Emperor Palpatine has a track record of moving on quickly from apprentices, and he may do the same with his dentists. It's just not worth the risk to me.
Now, young Skywalker, you will die.
And it's comments like that, especially from somebody as powerful as Emperor Palpatine, that really make me worry. Things don't go his way, and he's already threatening death. So this is my assessment of Emperor Palpatine. But it's often said that if you ask 10 dentists their opinion on a case, you'll get 11 different answers. So what do you think? Would you do something differently? Let me know on Twitter at Star Wars Dentist, or email me at starwarsschoolofdentistry@gmail.com. I'd love to hear from you and get feedback on the show. And you can leave reviews on Apple Podcasts if you'd like. And thank you so much for joining me on this first episode of the Star Wars School of Dentistry podcast. And I will talk to you on episode number 2. Thanks.